Hello, I'd like to welcome you to our next Community Connect session, where we continue to speak with professionals in the community who support neurodiverse individuals. Today, we will have a chat with Lee and Carol from Oral Health Home Hygienists to discuss your child's oral health, how to prepare for a dentist visit, and other tips and tricks. I hope you find this information helpful. If you have any further questions, please reach out to your therapy team. Hello, today we have Carol and Lee here with us from Oral Health Home Hygienists. I will take a minute for you guys to kind of introduce yourselves, your background in oral health, and what got you into this field.
Yeah, so I'm Carol. I'm an oral health therapist, been one for almost 20 years now. So, anyway, we'll go back. And so, we are experienced with kids from, you can say, all areas. Mm-hmm. Yep. We've been working with AIU Camera a lot. Mm-hmm. Yep. And what we really found rewarding this space is working with neurodiverse children. Yep. And getting them comfortable with something happening in their mouth. Yes. Perfect. So that's our background. But I'll let Lee introduce herself.
Hi everybody, I'm Lee. I've been working in oral health for many years. Lots of experience with working with little people. I still enjoy what I do every day, and I've enjoyed working with, as Carol said, AIU Camera with neurodiverse children. Really challenging me as a clinician as well you can't treat in a traditional setting with these children, so to be able to have fun and incorporate play into their oral health checks and hygiene practices has been really fun.
Yeah, perfect. And was there anything that inspired you to kind of get into this field in working with kids?
We love working with kids.
Okay.
We absolutely love working with kids. And so it's like your inner child gets nursed as well. It's great. But with the neurodiverse kids, we found that, it's a different way of being, you can say, and being together and being with the child, and making sure that everyone's on the same journey together.
Yeah, perfect.
I've also found too over the years we see children by 4 in the public service, and it's too late. We really need to see earlier, and a lot of children arrive with phobias. So if we can work with children when they're younger and take away the mystery and demystify going to the dentist or seeing a dental practitioner, that's really important.
Yeah, perfect. In your experience, what are some things that families with neurodiverse children find difficult when accessing the dentist?
Yeah, it's you can say it's a different space. Mm-hmm. Yep, it's a very challenging space as well. Even for a neurotypical person, you're thinking walking into the dentist, it's going to be all these bright lights, different smells, you're out of routine. Yep, you've got to make an appointment, get your child ready, get yourself ready. That's both for neurotypical and neurodiverse children. Yep. So it's that component of like being out of routine. Yep. Going to a foreign environment where sometimes we're not familiar with that, especially if it's the first dental visit. Yep, and you're expected to sit down, lay back, enjoy light. Everyone's in mask and gloves and PPE. Yep. You have things put in your mouth that you've never seen before. Up close and personal in your own personal space. To children that, especially neurodiverse, that is a very foreign concept, and sometimes it can be incredibly overwhelming. And the sensory preferences, of course, are going to be very different sometimes. So while we're doing in this setting in a play-based environment, children are a lot more comfortable with us. Yep. But trying to prepare the child also to have something in their mouth other than food, water, toothbrush occasionally.
Yeah, fun kind of atmosphere.
Yes.
Perfect.
Yes.
What kind of barriers have you found participating in that examination? Like I know you said there was people coming kind of at your face. Like what were some of the barriers that you find with actually going in and doing an examination?
I think, generally people that work in the dental environment have a lot of PPE, which is, I think it's overwhelming for little people. So to remove some of those barriers, just maybe gloves. Gloves are routine now, we're all used to them, and children are used to that here in their childcare setting for personal hygiene and toileting. So gloves are pretty much the only barrier we have. We try and look fun and funky.
As hang out with them. We won't wear a mask, of course. We don't get that close to a child to actually require that. I think removing the barriers is really important, and we're going into their environment, into that space that they feel comfortable and trust with their teachers and carers in their room, with their friends, and they're seeing their friends interact with us. So I think we're halfway there too with building that trust with them and rapport, and we're also going to be friends of the centre where the staff will get used to us popping in the morning time, which tends to be a better time to see little people. Yeah,
perfect. And is there any kind of barriers that you've come across with just toothbrushing? I know you spoke about barriers just with that examination and those kind of PP and all that, but what about toothbrushing?
On topic. Yes. Because I think a lot of children with different sensory preferences, you can see that sometimes they're not even comfortable brushing their hair. In that case, it's like the mouth is an incredibly sensory, diverse, you can say, environment. It's incredibly up close and personal. So the barriers, of course, is that it's not food and it's not water, so it's not drink. And so it's something foreign in your mouth that doesn't really serve a purpose sometimes other than to clean teeth.
Right.
So then, of course, we've got those barriers in terms of toothbrushing where children with neurodiverse abilities is that they don't want it. And a lot of the parents that sometimes say to us, it's like, it's a battle. We've tried every single toothbrush on the market. We've tried every single toothpaste on the market, different flavors, different designs, the U-shaped design. And I'm pulling out my hair because nothing's working. So then we start to say, hey, let's work on this toothbrushing together as more play-based approach. Say, let's make this fun. Let's make this fun together, and we're in this together.
And what kind of strategies or fun things do you do that parents can maybe try at home for those to make that toothbrushing more fun or that experience more fun? What kind of things do you work on and do?
Well, two things mainly come to mind. One is like role modeling. So if everyone can brush together, or if the child can brush, even their parents' teeth, to, really say, this is something we do as a part of our routine. This is a normal part of our family routine that we all do together. So even if it's with the siblings, maybe even you're brushing the dog's teeth. The dog's teeth or something like that. Yes, but if they've got a toothbrush, let them brush your teeth. So maybe in reverse, they'll let you brush their teeth as well. So it's all play-based and it's a part of our routine. Brush in the shower, brush in the bath.
Doesn't have to be morning and night. It can be whenever fits into that busy family's time.
But build it as a part of the routine. So if you can build it as a part of the routine, that it's not the last thing you do at night time or the first thing you've got to get done before you drive off somewhere in the morning where everyone's incredibly busy. The second one was going to be very much children wanting to control. Say in an environment like that, you can do play-based therapy. So let the child use a toothbrush. Play with a toothbrush on models. So if there's a dinosaur at home with lots of teeth or a baby,
Dolly.
or a dolly or something, then they can do the brushing as well. On that. Because we're learning about hygiene. We're learning about lots of hygiene and lots of brushing. So if they brush on that and they're practicing, then that way, hey, we're processing. This is a part of our routine.
Perfect. And for those kids that are maybe they don't prefer the taste of toothpaste, what would you kind of recommend in those situations?
That's a tough one.
It is hard.
Very hard.
At the end of the day, we're always taught at university is control plaque, control disease. Removing that plaque is the most important thing. So at the end of the day, there are some individuals that will never use toothpaste, but we will try. And there's different ways of introducing different flavours. A lot of young children do not like mint. It's just not a thing. So we can find other alternatives. So we just work along with that, and you don't need a lot of toothpaste. So often slowly introducing by wetting the toothbrush can be enough. Dipping the bristles in, like just tiny bit, could be just enough. Using a toothpaste that doesn't have sodium lauryl sulfate, which is the bubbling detergent that you get in toothpaste, might be just perfect for a child that can't handle the bubbles and the foaming in the mouth. So we try different things where some kids just love to get the toothpaste and suck on the tube, which we never want, but we work with each child and their family situation. And at the end of the day, the trick is to make it easy for that family. So it's really nice if you can have one flavoured toothpaste the whole family uses, and this takes away the drama and also the cost too.
Absolutely.
So,
So what other strategies and tips do you have for families who are preparing to actually go to the dentist or go to an actual facility for an oral health appointment?
Yep. So a big one we like to use is social stories. Yep. So developing the social stories, like, hey, today we're going to go to this dental clinic, Dr. X, and Dr. X looks like this. So having those photos of like who they're expecting to see is a huge component. It's like, so when you walk into the room, hey, I've seen this person on a picture before. Yep. And then even photos of the environment as well, like what does the dental chair look like?
Of that specific dentist.
Yes. So then that way you're demystifying that component. Yeah, it's like when I walk into there, I've seen that before. Yep, I've seen how it works. The video's even better. I like see the chair go up and down. Yep. And then if you happen to have an appointment, bring your child along with you. Yep. So the child's watching you go into the chair as well, and we're doing that positive role modeling to say, hey, Mum and Dad are going. This is a part of our routine. Yeah.
And do you have experience with dentists or local dentists that will allow you to kind of get those photos beforehand and have that ready?
Yeah, most clinics will be happy to provide photos. Yep, just call up and ask, really. It's like, hey, I'm making this appointment. This is my child's first dental visit. Like, I'd love to make sure that, we're all comfortable with this environment, that it's not a surprise to anybody. Yep. So it's like, is it okay if you share some photos of who I'm going to see, what the setting's going to be like, what the lights look like, maybe not the smells if we can, but yes, it would be great. Yes.
Yeah, perfect. No, that's great. That's great to know that you can kind of ahead of time get those photos and get that
and
prepared.
we send our photo out to any email to parents.
Photos on the fridge. It can be a bit scary, but
when you're walking, you're like, okay.
And so is that what you do to get ready to go into people's homes then, or what kind of strategies do you use when you are doing home visits?
So we love to get to know the child, sensory preferences and special interests as well. So we quite often send an email to the parent. It's like, hey, we're coming for a visit. Let us know. Yep.
Favourite toys.
Yep. What are you doing currently? Yep. To make sure that we're building that rapport, that relationship first, and we get to know part of the child. It's play-based. And then we also introduce that, hey, today's first appointment's all going to be play. Having fun together, before we get into the bathroom, and let's rush. Yeah.
And how many appointments would you kind of typically have before you do actually get in to see their mouth and see their teeth?
It really does depend, doesn't it? Depends on the...
We've had some really successful outcomes with a lot of complex young people needs. I have a Down syndrome young lady that never brushed her teeth, and she's taken probably 8 visits to see her, and she's now brushing independently. Still won't let me help, but her technique is beautiful, and just through play, I have watched her dexterity improve so much, and her fine motor skills that she can grip, brush teeth circular and do flicks, which are quite difficult.
So it depends on the child and that building that rapport, but play is number one. And trust.
So do you have any other advice when kind of either booking to see you or booking elsewhere for families?
Call ahead, and when we're making the appointment, ask, like, if you're seeing, not us, but somebody else, it's like, hey, is there someone on staff that is going to be okay and a lot more comfortable with neurodiversity? We'd love to know that person, because usually the person that's on the phone will know the staff preferences and who the supports can be for that appointment. So call and ask. So the huge component is like, hey, is it okay if I take some photos as well and create that story? So if the OT wants to develop a social story for you, they can help you do that component as well.
Perfect. And is there any other questions parents should be asking or mentioning when they make those phone calls?
Probably knowing the history too, like if your child's had a history of any dental or medical appointments or allied health, tell us, because it helps us understand their plan as well.
As well as preferences as well, like
superheroes.
Or are they routine based? Is it morning appointments that are best? Afternoon appointments? Because, of course, you know your child the best.
Yeah.
So when do you think they will be okay with that appointment?
With that appointment. Yeah, perfect. All right. So do you have any other tips for parents to advocate for their children while they're at the dentist?
Yes. Well, children, especially if it's a first dental visit, it's not always going to go smoothly, you can say, and we totally acknowledge that component. But I guess it's like always trial. Like, let's just do this as a first try. And then if it doesn't work out, can we try again? And just trying to build that rapport that this becomes a familiar environment for them as well. And working with the dental team there, it's like, hey, today's visit might not be the ideal outcome. But is it okay that maybe we try and come back a different day or a different time where maybe things are going to be a bit more comfortable? Can they bring their toys with them? Are there any things we need to dress up for, dress down for? Should we have that PPE? Should we not have that PPE? So doing those things to make sure that the child also feels comfortable in that environment. So it's almost like, if first time you don't try, oh, it doesn't work, try again.
Yeah, perfect. So advocating in that moment. So like today's didn't go well, but is it all right if we come back?
And some children are better with one parent. Could be better with dad or sitting on mum's lap or coming with grandma. So tell us, we'll work with that.
Yeah, perfect. All right. Well, thank you guys. This was a lot of great information. Was there any final things or any kind of stories you wanted to share before we end?
Maybe since commencing at AIU at Camira, we've become very flexible. We've seen little people under sprinklers, on trampolines, and
Swings.
on swings. So we just try to approach it in a fun way and work with whatever we can with the environment we have.
Perfect.
Definitely. Because we strongly believe in prevention, and prevention is the best, to a degree, medicine. But we definitely want to do prevention-focused dental play-based therapy. So we don't want to see a child where they're in pain. But if we're able to prevent that from occurring, prevent the toothache, prevent the decay, prevent the gum disease by establishing early habits, that's what we're here for, because we're really prevention-focused.
Perfect. Thank you. Thank you both.
Thank you.